So, welcome everyone to Gilda's Club Kansas City, Fear of Recurrence. This is Savannah Geske, and I'll let her go ahead and tell you a little bit more about herself and on with the presentation. So, thanks so much for being here tonight.
Thank you for having me. Yeah, like Amy said, my name is Savannah Geske. I am the clinical psychologist for the St. Luke's Cancer Institute and the Kuntz Center for Advanced Breast Cancer. This is, probably the fourth or fifth time I've given this presentation on fear of recurrence. And so I've been trying to kind of keep up to date with the literature and kind of update interventions and research as it becomes available. So hopefully there are some things that you might not have heard of before in helping to reduce anxiety surrounding occurrence. And so let's get right into it. I always like to start off my presentations just by sharing some general stats, just because I think it's important when we talk about fear of recurrence and other issues that we can see related to cancer. I really like to make sure that everyone is aware that these are very normal experiences, and so I like to just highlight how many individuals are actually struggling with this. So as of January 1st, 2014, there were 14.5 million children and adults with a history of cancer living in the United States. And that rate is expected to increase to almost 19 million by 2024. This is important because individuals experience a variety of unique post-treatment effects that follow their treatment, and fear of recurrence is one of those. So what exactly is fear of recurrence? Definition is fear, worry, or concern related to the possibility that cancer will come back or progress. And this can be shown in several different ways. So first, this can be occasional thoughts about cancer. So as we start to see that a scan day is approaching or an appointment, just having some of those occasional thoughts of, well, I wonder what they're going to find. I wonder if cancer is something that I will have to struggle with again in my lifetime. And those can really start to progress after that. And so there can also be a sense that you are unable to control those thoughts or those worries. And those can progress to constant intrusive thoughts. These thoughts can be so intrusive that they can make it difficult to concentrate, sleep, quality of life. We see that it causes peaks in anxiety with triggers that resolve within a few days. There could be a conviction that the cancer will return, interruption of mild and unrelated symptoms as a result of recurrence, and an inability to plan for the future due to worry that cancer may return. So we really see that this can fall on a spectrum from just some minor thoughts or worry about cancer recurring to being so significant and intrusive that it makes it difficult to function in some cases. What I also like to say about fear of recurrence when we talk about what it is a normal reaction to an abnormal event. This is a very normal reaction that we would expect someone to see when they encounter a very significant stressor or trauma. I always like this picture because I think this really kind of highlights this experience. Is when I talk to a lot of people who talk about anxiety after treatment and fear of recurrence specifically, I hear a lot of people who kind of feel like they're not understood or they think that they're going through this experience alone. But as we'll talk about, this is actually an experience that's shared by a lot of people. So while it might feel like we're on this island all by ourselves, we actually can see that there's a lot of other people who are on this island with us and struggling with that same thing. So who gets fear of recurrence? About 50% of all cancer survivors. We see that this can also change based on cancer type, stage. So 86% of women with non-metastatic breast cancer will worry about recurrence at least a little bit. There was also an interesting study that was did on orophacial cancer survivors. And at 3 months post-treatment, 80% reported a fear of recurrence, 72% reported a fear of recurrence at 7 months, and only 3% reported no concerns. This other study that I think is very interesting as well is they interviewed testicular cancer survivors almost 12 years after their treatment, and 24% still reported worrying about cancer recurring quite a bit, and 7% worried about their cancer recurring very much. So we see this as a very common concern in that first year after treatment and can persist for several years. These rates are also higher for individuals who are female, young, and socially isolated. There's a variety of consequences of fear of recurrence as well. Studies have shown that individuals who have higher rates of fear of recurrence also report higher mental distress, fatigue, and tobacco use. And so this is very significant for any of our individuals in the audience, who have any, cancers that are related to tobacco use. And so, of course, we already went through all this treatment, and we want to make sure tobacco use can stay low so we don't get another recurrence. Individuals who have fear of recurrence, we also see report lower ratings on quality of life measures. Individuals who experience fear of recurrence also engage in a variety of what we call compensatory behaviors. So they are overly monitoring and sensitive to signs of any cancer activity. So, oh, I felt a pain in my back. Is that possibly a new tumor? I woke up this morning and I got a crick in my neck. Is that possibly cancer? And so we see that individuals kind of are hyper aroused to their own body. We also can see constantly searching online for information related to your particular cancer and its treatment and prognosis. And some individuals also start to fearfully avoid screening and follow-up. So this idea that, well, if I just don't go in and get scanned or go in for my follow-ups, they're not going to find any cancer and then I won't have to deal with it. Which I think most of you know from talking with your treatment team is something that they would not recommend because we really want to be actively following you, because if anything does happen, the sooner that we can identify and intervene, the better outcomes we are going to have. Scanxiety is also something that I like to talk about with fear of recurrence, because we know that fear of recurrence also fluctuates around mammograms. This is a study that was reported in 2016. So what we see is that as we approach mammograms, anxiety starts to increase, and is most significant in kind of that day before or morning of, and is pretty high as we await those results. Then we get the results and the anxiety almost completely dissipates. And then we have another good couple months or couple weeks until we start to schedule that next mammogram, and then it starts to increase again. And so while this study was specifically with mammograms, we see that scanxiety is experienced across individuals with any cancer type, and at least 83% of people report some distress surrounding scans, specifically worrying about fear that it's going to pick up that cancer has recurred. So why does this fear of recurrence happen? I think it's important to discuss anxiety and the fight or flight response in general. So we as humans are not really good animals. We're not very strong. Our nails are, very well manicured in some cases, but they're not very sharp or good for scratching or biting. And our teeth are a little bit more like cow's teeth. They're more meant for chewing, not really meant for attacking or biting. And so when we used to live in forests and fields and things like that, we were actually pretty weak animals. It's really our brains that helped us evolve, create cars, weapons, moved into cities. But before we did all that, we had to have a way to keep ourselves safe, just like every other animal. And so what we developed is the fight or flight, and you also might have heard or freeze response. And so what happens is, let's say, again, your ancestors were living in the forest and they came around a corner and they saw a bear. Well, right away, what we're going to see is that a variety of sensations happen immediately. Your heart rate starts increasing, your blood pressure increases. You'll also sometimes notice that feeling of butterflies in your stomach. That's actually your blood rushing to your extremities so we can fight or run away. So a lot of physical things happen, muscle tension, and then our brain starts to think very quickly, because what our brain wants to do when we encounter a danger is to figure out, how are we going to get away from this danger? Are we going to run? And if so, where? Are we going to climb up a tree? Are we going to swim across that river? Where are we running to? Or if we're going to fight, how do we want to approach this other animal? And so we have a variety of physical and mental processes that happen when we encounter a danger. Our body also releases adrenaline and cortisol and all those other good stress hormones that keep us very tense and activated. And they also decrease our need for sleep because, of course, if you're being chased or you're in a fight, the last thing your body wants you to do is say, oh, I'm tired, I think I'm going to lay down here and take a nap. So I have in bold here, for short-term stresses, that is an excellent response to have. If you were truly being chased by an animal, I would want all of these things to happen, and I want them to be very robust because we're increasing your chances of getting away. However, we see that as we as humans have moved into urban areas, we have cars, we have weapons, and we're really top of the food chain. We don't have a lot of predators. Our body has not let go of this fight or flight response. And so we see that our body responds the same to even long-term stressors like cancer as our body does to those short-term stressors. And so this fight or flight response gets kicked in. We've told there's something inside the body that's not supposed to be there, and our brain goes on high alert. The only problem is this fight or flight response doesn't come for free. It requires quite a bit of resources from our body. So as that fight or flight response stays activated, we start to feel unmotivated, lethargic, worn down, hopeless. We start to see a lot of negative consequences start to come after that. A lot of times people also don't necessarily notice this fight or flight response when they're in treatment, because when the body's actively in treatment, our mind kind of says things like, all right, we're doing something, right? We've been told that there's something inside of our body, so we're doing something about it. I'm going to my appointments, I'm getting my surgeries, I'm going to my radiation treatments, I'm doing everything that I'm supposed to. And so the body feels like we're doing something, kind of like that running or that hiding. But when those things abruptly stop, so we are told you're done with chemo, you're done with radiation, you're done with treatment, and we don't need to see you for 3 months, the mind and the body become agitated and thoughts begin to cycle about that cancer returning because there's no more treatment. And our brain thinks, well, if we're not in treatment, we're no longer safe. And so those fight or flight responses sometimes can become more prevalent after treatment is over. I actually see quite a few individuals when treatment is over, because that's when their anxiety is highest. And again, we're hypothesizing because we had all of this support, we were in treatment, our brain felt like it was doing something, and then it just abruptly stopped. We also have to recognize too that a large support system is gone. We don't have nurses and a doctor who are reassuring us every time we go in, hey, we don't see anything, we still don't see anything. And so we also get that constant reassurance from lab work and scans. So now that we know why fear of recurrence happens and the negative consequences that it can have, I want to spend the rest of the session, or this talking about coping strategies. Because if it's bad and can cause some negative consequences, we want to make sure that we can get rid of it. So the first thing that I always like to talk about is mindfulness. And so this is the act of being consciously aware with mindful attitudes. We have very good evidence that when people practice mindfulness techniques, they have reduced depression, anxiety, fear of recurrence, stress, and fatigue. We also know that mindfulness techniques improve sleep and improve quality of life measures. So when I talk about mindfulness, I always like this train analogy, so we're standing on this train and our brain just constantly, like a toddler, kind of presents us things and says, what do you think about this, right? And it's up to us to decide whether or not we want to act on that thought. So a good example I always like to use is, all right, you've packed for a trip, you're on the highway, you're headed to the airport, and your brain goes, hey, what if you forgot something? And so our brain is saying, here's something, what do you think about this? And we can choose to say, well, I'm already in the car, I can't go back now, so even if I did forget something, I can't do anything about it, and we let that thought pass by. So kind of this train's pulled up, our brain's presented this to us, and we're saying, I really can't do anything about that right now, so we let that thought just pass us by. Train pulled up, stopped for a second, and then went on. Another option is to say, oh my gosh, maybe I did forget something. Did I pack my phone? Did I pack my swimming suit? I wonder if I have my passport. And now what we have done is when that train has pulled up, we have boarded that train. and said, this is a potentially anxiety-provoking thought. Let me get on it and think about this for a long time. And so just like with fear of recurrence, our brain occasionally might present us these thoughts with, what if my cancer comes back? And so we have that choice to say, all right, I'm going to get on board with this, and I'm going to think, well, what if it does? Then what am I going to do? And start really going down that rabbit hole. Or we can kind of be in that position where we say, well, if it does or it doesn't, we really can't do anything about it right now, and let that thought pass by. It's very easy to say in theory, right? Well, let's just not interact with that thought and let it pass by. And so what we want to be doing is practicing these mindfulness techniques so we can improve your brain's ability to just acknowledge these thoughts, but then let them pass by. And so this is where I really like mindful breathing meditations, because with mindful breathing meditations, we give you a focal point, and the focal point is often your own breathing. So it's something where your mind can consistently come back to instead of engaging with those other thoughts. And so what I like to do, and you'll see me glancing at my phone to make sure that I'm staying on track with time, is I want to practice a short mindful breathing activity just so everyone can kind of get a flavor of what these mindfulness exercises are. And so what I'll have everyone do, it's nice when everyone's home because we don't have to worry about someone looking at you or anything like that. I'm just going to have everyone get in a nice comfortable position in their home, staying seated. I always like when we don't have any crossing because then we're not restricting blood flow. And either go ahead and close your eyes or find a spot on the floor to just kind of affix your eyes to. And I'm going to walk you through a short mindfulness exercise. Roll your shoulders slowly forward and then slowly back. Lean your head from side to side. Relax your muscles. Observe your breathing. Notice how your breath flows in and out. Make no effort to change your breathing in any way. Simply notice how your body breathes. Your body knows how much air it needs. Sitting quietly, see in your mind's eye your breath flowing gently in and out of your body. When your attention wanders, as it will, just focus back again on your breathing. See how your breath continues to flow deeply and calmly. Notice any stray thoughts, but don't dwell on them. Simply let the thoughts pass. Notice the stages of a complete breath, from the in-breath to the pause that follows, the exhale, and the pause before taking another breath. As thoughts intrude, allow them to pass and return your attention to breathing. See the slight breaks between each breath. Feel the air entering through your nose and picture that breath flowing through the cavities in your sinuses and down to your lungs. See the air inside your body after you inhale, filling your body gently. And notice how the space inside your lungs becomes smaller after you exhale and the air leaves your body. Notice how your body feels. See how calm and gentle your breathing is, and how relaxed your body feels. Keeping your eyes closed, notice the sounds around you. Feel the floor beneath you. Feel your clothes against your body. Wriggle your fingers and toes. Shrug your shoulders. Straighten out your arms and legs. And open your eyes. When we get to the end of the presentation, I'm going to have a slide for resources, and there's going to be a variety of books, apps, and websites that you can look at for some more of these mindful meditations. I would really encourage, if you're someone who hasn't done meditation or mindfulness before, to really look for guided ones so you have someone talking to me the same way that I was talking to you, because then we also get the added benefit of someone's voice to also focus your attention on. I also really like any of the mindfulness body scans where we start at the tip of our head and we just attentively attune to each of our body parts. Because again, with that fight or flight response, our brain has now become hyper aroused to our own body sensations. But even before cancer, every person had weird aches and pains and woke up not feeling right. And so we need to recognize that some of these are just normal things that our body does. And so I like the body scan because when we are actively paying attention to our own body, we can start to feel, how does our body now feel after all of this treatment? Maybe I do have a pain, but I experience it every morning. That just might be my new normal because that's where it was radiated, or that's where I have some scar tissue. So I really like those mindful body scans as well. The other technique that I really like is cognitive therapy. And so when we talk about cognitive behavioral therapy, we look at how our thoughts influence our feelings and influence our behaviors. We actually see that it's a nice little triad, and each of those arrows is bidirectional, so they all influence each other. And one of the ways that we can intervene is by examining our own thoughts. This is my favorite example. So, and I'll kind of, normally if we were all in person, I would ask for your all feedback, but I'll generate the responses. So a friend walks by, you say hello, you give them a little wave, they look right at you and they just keep walking by. So what happens is our brain is constantly narrating what we think is happening. And so if we see a friend look at us, we can ask ourselves, why did they do this? Well, a lot of people will jump to, she's mad at me. I did something. She's upset. And so we kind of jump to that somehow I'm in trouble and I did something. If those are the thoughts that I jump to, how is that going to make me feel? Anxious. I'm going to be upset. I might be angry. And how will that influence my behavior? Well, I either might send her a nasty text message, or if I think that she's mad at me, I might call her and ask her why she's mad. What did I do? So the simple thought now influences how I feel and my behaviors that happen afterwards. So the same thing can happen with these anxiety-provoking thoughts about, what if I get cancer? Well, that makes me feel anxious, and now what I'm going to do is I'm going to get online and research, how do I know if I'm going to get cancer again for the next 3 hours, right? So that simple thought influences feelings and influences behavior, and so we really want to intervene, because in this case, if the thought was, you know what, A lot of times when she's in a rush, she does not see what she's doing. She probably didn't even see me. Or she's not wearing her glasses and I know she can't see well. Or maybe there's an emergency. That's going to make me have feelings of more neutral, right? Or I might even be concerned. And how will this influence my behavior? I still might check up on her, but then I won't feel so anxious or angry until I talk with her. So when you have anxiety-provoking thoughts about cancer recurring, I really like this CBT thought record. And so this is easily found online. And so if you wanted to take a quick picture of it, it's just called the thought record. You also might find what's called a simple thought record, but this is a very accessible sheet and I like it a lot. And so what I like about this is it lets you give, where were you, what was happening, what was this triggering event, what emotion did it instill, and then what was the thought that followed after. So a very common one that I hear a lot is, I was in the kitchen and I was going through my planner and I flipped over to the next month and I saw that I was going to be having my annual screening. And that immediately made me feel anxious because I had the thought, they're going to find cancer, right? The last time I got my mammogram, they found it. The last time they did a chest CT, they found it. And so I immediately jumped to, they're going to find cancer. Well, then what we want to do is we want to examine the evidence that supports that thought and the evidence that doesn't support that thought. So again, kind of hypothetical situation, compiling together statements that I've heard in the past. Well, what's the evidence that supports that? I have a lot of people who say, well, I just know, right? I got cancer before, I'll get it again. Or I have been noticing a pain, so I'm pretty sure that's an indication. So we want to write down any of that evidence that we think supports that thought. And then we want to write down, well, what is the evidence that does not support that thought? And so here's where the first place we want to go is, what has our medical team told us? Then I have a lot of people who will say, well, my medical team has told me that my risk of this coming back is relatively low, even though there is a chance. These are the type of things that they told me to look out for, and I haven't been experiencing any of those. And so we really just want to look at what is that other evidence. And I really like at the bottom of this sheet, it gives you questions to ask yourself if you get stuck. And so we can, one that I like a lot is, if my best friend had this thought, what would I tell them? Are there any small exceptions that contraindicate this thought? So this would be good for those weird pains and aches that we get. We might say, oh, I have a pain, it's cancer, right? Well, are there any exceptions? Yes, even before cancer, we got tons of aches and pains, or even through cancer, we got tons of aches and pains and they were nothing. Just normal age-related things that our body does. Or could I be jumping to conclusions? And so these are a lot of statements that I like asking ourselves when we're looking at, is there any evidence that does not support that thought? And then what we would like to do is create an alternative thought. And so this alternative thought does not have to be sunshine and rainbows. I sometimes have people create the alternative thought of, I'll never ever get cancer. Well, now we've almost gone on the other extreme. If we're thinking I'm definitely going to get cancer, or I will never ever get cancer, we're living in extremes. We want to have a very realistic kind of married thought. And so a more alternative thought would be, well, my last scan was clear. I've had these aches and pains before and they haven't resulted in anything. And even if cancer did come back, that's why we're doing scans every so much, so it can be caught early and we can intervene early. So you see that this isn't a super happy thought, but it's less anxiety provoking than my cancer will absolutely be found next month on my scan. So this is where we also talk about intensity of emotion. So we might still feel anxious, but instead of a 10 out of 10 having that thought, my cancer will absolutely recur, our anxiety is maybe more of like a 4 or 5 out of 10 with, well, it's a possibility, but the team doesn't think that's going to happen. We're doing my mammograms and I've had these pains before and nothing has happened as a result of that. And so I really like this sheet to just kind of challenge some of those anxiety-provoking thoughts, those ones where we kind of seem to be jumping to those extremes or those conclusions. I also really like progressive muscle relaxation, and this is a form of mindfulness. This assists the body with realizing the difference between feeling tense and feeling relaxed by tightening and releasing muscles. We also see that progressive muscle relaxation can help reduce nausea, vomiting, anxiety, and depression. And I also run a group for cognitive behavioral therapy for insomnia, and this is the mindfulness technique that we have individuals do before sleep. And so if you have anxiety-provoking thoughts that might be keeping you from falling asleep, this is also a good technique to be using before bedtime. And so we will also do a couple minutes with the progressive muscle relaxation, but I always like to point out that there are 2 times where you should not be doing progressive muscle relaxation. Number 1, if you have any significant cardiovascular illnesses, like significant hypertension or a history of any heart events, it's really not encouraged that you do progressive muscle relaxation because we can be increasing and lowering blood pressure and heart rate. And if you have any pain disorders like fibromyalgia or any significant back pain, it's also not a great idea for us to be doing progressive muscle, because then we're tightening muscles around joints that are already sore. And so I'll be walking you through a progressive muscle relaxation just a couple minutes, but if you have either of those, please don't do that. Just kind of listen along, and we'll be talking about some other techniques that will be helpful for you. But anytime we do progressive muscle relaxation, and you can be as broad or as specific as you want, but we are tensing each muscle group for about 5 to 10 seconds, very tense, so we can notice that tension, and then we are relaxing for about 10 seconds so we can focus on what it is like to feel that tension relax. And again, you can get very specific. We can do our hands, then our lower arms, our upper arms, our face, our neck, our abs. We can get very specific or very general, just upper extremities and lower extremities. I really like doing as many small pieces as you can. And so we will start, and I will guide you through a couple progressive muscle relaxation body areas. And again, you really don't need to have your eyes closed for this, but I usually do like closing my eyes just so then we also don't have this external stimuli, and we can just focus on those sensations. And so start with your right hand and your right forearm. Make a fist and squeeze as tight as you can for 5, 4, 3, 2, 1, and relax. Notice how your body feels relaxed versus tense. Now go ahead and clench that right hand forearm again for 5, 4, 3, 2, 1, and relax. Again, noticing the difference between that tightness and now being relaxed. Now let's go to your right hand, your left hand and forearm. Make a fist and tighten as hard as you can for 5, 4, 3, 2, 1, and then relax. For 9, 8, 7, 6, 5, 4, 3, 2, 1. Tighten that left hand and forearm again for 5, 4, 3, 2, 1, and relax. Feeling that blood rush back into that extremity. Feeling the difference between being relaxed and feeling tense. Now let's do your eyes and cheeks. Tightening them, squeezing your eyes as tight shut as you can for 5, 4, 3, 2, 1, and relax. Feeling the difference between that tension and now feeling relaxed. 3, 2, 1. Then tighten those eyes and cheeks again, as tight as you can, for 5, 4, 3, 2, 1, and then release. Feeling that natural relaxation of those muscles as they release that tension. And then finally, we're going to tense those shoulders. And so we bring those shoulders up as high as we can towards our ears, and we tense for 5, 4, 3, 2, 1, and release. Dropping those shoulders, pulling them back, feeling the difference between those tense shoulders and now this relaxation. And we're going to tense those shoulders one more time as high as you can. Tense towards your ears for 5, 4, 3, 2, 1, and release. Again, feeling the difference between that muscle tension and now this muscle relaxation. And then you can open your eyes. This technique I really like a lot because you don't need necessarily someone to guide you. When I get to that resource list at the end, there are resources where you can go, but I like this one because you can be laying in bed and doing that on your own. This is also good because our body naturally, when we have that fight or flight response, tenses around our joints and muscles. And so this is a good way for us to kind of start understanding that difference between tension and relaxation, and kind of helps us start to relax that body out. I think this goes without saying, but talking with others also facilitates cognitive and emotional processing of the cancer experience and can assist with well-being. Hiding or ignoring fear and anxiety can make it stronger and more overwhelming. I always equate this to either we're stuffing things into a closet and then we're like shutting that door and then just hoping that no one comes there and opens it again. But we've shoved so many things in there that it just doesn't take too much for that lock to kind of pop open and all that stuff to be spilling out. And so when we keep just pushing everything back in that closet, it's only a matter of time until we experience another trigger and all of that comes rushing out. And so talking with others, whether that's one-on-one or as part of a support group, can be very beneficial. However, I would like to highlight that our support system is inherently flawed because it's made up of people who have their own thoughts and feelings about you and your cancer experience. I have some individuals who can be very overly positive, very cheerleader, which I think sometimes we need. But when we're trying to talk about some of these more heavy issues, that can also feel like we're kind of being minimized, right? Like that person doesn't necessarily understand what we're talking about or what you're going through. We can also see that just due to their own fear or anxiety, they can be overly negative or even check out. Like they don't want to hear about your treatment. They don't want to hear about these fears of your cancer coming back. They're doing that so they don't have to feel upset, but that leaves you feeling very isolated. And then I also can see people jump in and they try to fix or solve. Well, if you think your cancer's coming back, why don't we go ask the doctor? Why don't we do this? Why don't we do that? Again, it's coming from a very good place, but again, can kind of make individuals feel kind of misunderstood or misheard. So this is where I think it's very important when we do have conversations with others, really just at the beginning of the conversation, educate and tell them what you want and what you need. So if you do, again, your spouse or one of your friends is a fixer, likes to always try to be fixing things, you really just start the conversation off by, I kind of have some stuff that I want to talk about, I need to talk through, or I need to vent about, and I don't want any fixing, I just want you to be able to listen to me. Perfect. We see that support systems very much want to support you, and so honestly, if they get some of that direct feedback, they are very likely to listen to that because they do just want to do whatever you need to make yourself feel better. Social support through groups is also good. Again, Gilda's Club, even during the pandemic, has multiple support groups. We'll talk a little bit about some of the groups that St. Luke's offers, not specifically support groups, but more psychotherapy. And then there's also several online groups, Facebook groups. I would always say, kind of take a grain of salt if you kind of do start going into Facebook groups and some of those other groups, just because those are moderated by, again, other people with thoughts and opinions. So we have to recognize, does this group make me feel better? Or am I feeling more anxious and maybe I need to find something a little bit more structured? I can also see that even after giving family feedback of what we need from them, they just can't. Due to their own emotions, they can't sit with you in that space and help you process. And then that's where journaling comes in. This is a really good substitute for talking to other people. What I really like is we think faster than we talk, and we talk faster than we write. So when everything's in our brain, it's just going very fast. We're skipping from one topic to the next. And so when we start writing, we pump the brakes, we slow down those thoughts, and we really give our brain a chance to write these out slowly, and it allows time for processing. So instead of just jumping from one topic to the next, going, what if that happened? Wouldn't that be awful? What if this happened? Wouldn't this be awful? We actually get a chance to sit with that thought and think, well, what if it did happen? What would we do? Or what exactly am I worried about will happen? A lot of times when we start writing things down, I'll have people who say, you know, once I started writing it down, it kind of became clear that that was pretty unlikely, even as I was writing it down. And you don't have to keep this. I have a lot of people who don't journal because they don't want to look back at it. You absolutely don't have to do that. If you get done journaling and then you want to tear it out of the journal and rip it up, by all means do that. It's more for processing in the moment. I also really like scheduling worry time. When I tell people about this, I get a lot of kind of bewildered looks from people about how in the world would this make things better. This is very good if your brain can't shut down at night and your brain just spends time thinking and worrying and wandering. And this can be about anything, you know, getting the groceries, thinking about scans, thinking about what the doctor's going to say at the appointment, or making sure that you don't forget your questions. This is where I really just like to set a time every day and put aside about 10 to 15 to 30 minutes in the morning or the afternoon. I actually really like it before bedtime, and just sit down and write out our worries. And then we write down all of the worries or the mind wanderings or anything that is on our mind. And we also give ourselves time to generate potential solutions. And then during the day, when we start to worry and we start to think about other things, we can also remind ourselves, since we have that worry time scheduled, now is not the time to worry. We do that at bedtime, right? We do that at 9, or we do that in the morning, whatever time works for you. And there's a lot of really good evidence that when we have a set worry time, our brain is more likely to put those worries aside because we know that we'll have time for it later. And we also feel like sleep is able to come faster because we've already taken that time to process those worries. And so I really like worry time. It can feel kind of weird when you first start doing it, but if you get in a regular habit, this is a technique that can be very beneficial and can be very good for sleep onset. Obviously, self-care is very important too. This is even more important now with the pandemic. I have a lot of people who have really just fallen off of their self-care routine and really aren't doing a lot of things for themselves. You know, even like at St. Luke's, massage therapy is something that we offered, and I always encourage people to go. That has also been placed on hold with the pandemic. But hobbies and activities, that is still something that we can do. And honestly, with us spending more time at home, something that we should actively be doing and doing every day. Deep breathing, exercise is very good. That decreases pain, decreases fatigue, decreases distress. And then also always following proper nutrition, because if we're not getting good diet, that can also increase anxiety. I really like this deep breathing technique. This is what we call four-square breathing or box breathing. And what you do is you breathe in for 4 seconds, you hold for 4 seconds, you breathe out for 4 seconds, and then you hold for another 4 seconds. So you breathe in, 2, 3, 4, hold. Breathe out, 2, 3, 4, hold. If you have not practiced deep breathing before, those holds are going to be too long for you. You're probably going to want to start with holding for about a second. And then as you feel more comfortable increasing those holds, there's really no point to go after 4 seconds. But I really like this four-square breathing because it starts to lower your heart rate, it lowers your blood pressure, and we are naturally combating some of those fight or flight response of what do I need to do? Should I go? Should I hide? And it's very good for recentering our brain, because if we're focusing on breathing, we're now not engaging with those thoughts. And this is one that we don't need to be. We don't need to be on a website. We don't need to have our phone. It's very simple. We can do this in the waiting room when we're driving. I really like this technique just when we're kind of out and about during the day and we're starting to feel anxious. I also like guided imagery, and so this is another form of meditation, and it involves activating all of the senses. It also assists with stress reduction, and there was a study that showed that after guided imagery, there was a temporary increase in the number of immune cells that were produced, and it helps reduce feelings of depression and increases well-being. We don't have enough time to practice that, but the resources that I am going to give you today are also going to be including guided imagery. And so that's another one to practice with. So the mindfulness, we've looked at some breathing meditation, some progressive muscle relaxation, and some guided imagery. And so any of those would be good to practice and kind of experiment with. Also, I think this can't be understated. Just also roll with your fears. I think, again, we sometimes try to shove everything in that back room and pretend like it's not happening. If anything, we really want to be very aware that you have anxiety and look for what are your triggers. So is it appointments? Is it scans? Is it a diagnosis date, surgery dates? We can also see that other people's life stressors and cancer diagnosis can agitate us. And so the best thing we can do is recognize that we have anxiety, look for triggers, and then form a plan. So if you know that your diagnosis anniversary is something that's anxiety provoking for you, well, then we need to do some preparation around that. We need to start doing mindfulness. We maybe need to schedule, something so we have something to look forward to on that date as well, so we can start to change our memories of that date. Really just recognizing that this is something that we're struggling with, and then forming a plan so we can be more successful. And then also talk with your healthcare providers. 80% of those with cancers prefer to work with their healthcare team to make treatment decisions, but only 44% of them shared quality of life concerns with their providers regularly. So we have all these people saying, I want to be involved, but then only half of those individuals are even sharing what's impacting their quality of life. Another study in 2014 found that what patients expected from their discussion with their provider did not always align with what was actually discussed. So we saw that 89% want to discuss long-term treatment. Again, so kind of what would happen if this were to occur? What would we do about that? But only 43% reported that happened. 70% also reported that it was important to get a discussion and even referral to supportive services, but only 36% reported that happened. And so it's very important for you to be sharing your concerns with your oncologist, be informed of what the symptoms for your type of cancer recurring are, and to keep up with your appointments and scans. That being said, what are some of the warning signs that we have gone past fear of recurrence, which again is a normal response to an abnormal event, and we're maybe experiencing something a little bit more clinically significant like depression or real significant anxiety? With a depressive episode, we're going to look for a depressed mood almost every day, loss of interest, significant weight gain or loss, insomnia or oversleeping, feeling restless or sluggish, loss of energy, feelings of worthless or guilt, difficulty concentrating, or even recurrent thoughts of self-harm or death. And with anxiety, we're going to look for constantly feeling restless or on edge, fatigued, poor concentration, irritability, muscle tension, sleep disturbances, and these are going to be lasting for several weeks, so consistent all day long for several weeks. If you start to experience either of those things, for several days on end, I would really encourage you to reach out with your medical team, because at this point we think that might be something a little more significant, and you may benefit from medication or talking with the mental health provider. In terms of mental health providers that we have here in the city, of course, I work at St. Luke's, so I'm gonna plug St. Luke's. So myself, I'm on the Plaza on Tuesdays and Thursdays, and at East on Monday, Wednesdays, and Fridays, offering video visits and in-person visits. Our other psychologist, Dr. Katie Harry, is at Liberty on Mondays, and the Plaza on Tuesday, Wednesdays, and Fridays, also offering in-person and video visits. If you think that you would benefit from meeting with someone and talking about these items in more depth, or even troubleshooting some problems to adherence, our supportive services line is listed there. If you're getting treated over at KU Medical Center, they have also several very capable psychologists who would be able to talk to you more about any of these issues. And if you're looking for somebody, who might be closer to your home, Psychology Today is a nice website. However, I would argue that with COVID-19, most of us are able to provide video visits, so I can see anyone anywhere in Missouri or Kansas. And so when we go to Psychology Today, it can be hard to find someone who specializes in cancer. So I would almost argue contacting your cancer center and seeing if their therapists provide video visits, because then you can be anywhere in the state. And at St. Luke's, we offer individual therapy, and we also have multiple groups, including Dr. Katie Harry runs a mindfulness cancer care program. And so it's essentially a 9-week program that goes over all of those mindfulness techniques that we taught in much greater detail and over a longer period, and is a very good resource for kind of helping decrease that fight or flight response. And if you have any of those fight or flight responses that are interfering with sleep, I run our cognitive behavioral therapy for insomnia group, and we also offer both of those in individual. And so here's that resource page I was talking to you about. So I would go ahead, probably snapping a picture of it would be a better idea. This is also going to be recorded, and so it's going to be available on the website. So if you want to look at it later, you can see a couple books: Mindfulness Workbook for Dummies, Mindfulness, an 8-week plan for finding peace in a frantic world, Wherever You Go, There You Are, multiple phone apps. You can also just find these easy on YouTube. And then also on the right-hand side is a couple websites where you can also go to find some more resources about these techniques that we talked about. And that is everything that I have for you. And so I suppose with the couple minutes that we got left, I'll let Andy take over and field some questions.